Okay, let's get started, guys.
Okay, Steve, we're on.
Thank you, Chris. And we do apologize for the audio-visual problems we've had, but we're going to begin our webinar. I'm Steve Love, President, CEO of the DFW Hospital Council. We want to thank you for being here today. This is obviously an educational webinar, and it's hosted in coordination with Mediktor, an associate member of the DFW Hospital Council. Today's topic, AI-powered care navigation assistant, a new benefit for healthcare and for patients. This should be a very exciting and fascinating discussion. As we announced in October, we're partnering with Mediktor to introduce their product to North Texas. And this collaboration hopefully will benefit hospitals, large physician groups, and they will be able to use the artificial intelligence triage with accurate AI medical assistance, which directs patients to the right level of care at the right time. Today's speakers are going to include a host of experts. It's going to include Vicenc Ferrer, Managing Director of Mediktor's New York headquarters, and a panel which will include myself, Dr. Ronald Pope, Chief Medical Officer at Albany Med, Columbia Memorial Health, Dr. Arnold DoRosario, Chief Population Health Officer at Northeast Medical Group, Yale New Haven Health. And then finally, Fred Pineiro, U.S. Growth Officer at Mediktor. Now, one thing I want to say administratively, please, if you have questions, type them into either the question box or the chat box, and they will be answered before the end of the presentation. And with that said, I'm going to turn it over to Vicenc.
Thank you, Stephen, for your kind words, and we want to thank Dallas-Fort Worth Hospital Council for co-hosting this webinar with us. Mediktor belongs to a space within the intersection of healthcare and AI that is becoming more and more relevant for key players in the healthcare industry. And among those, hospitals and health systems are by far the most enthusiastic about the opportunities around AI in this industry, in the US market. Today, we are going to focus on how patients and healthcare organizations can leverage AI to improve care navigation. But first things first, let me give you a quick overview about Mediktor. Mediktor is a global company with offices in New York and Barcelona and a total headcount around 65 people. We have presence in 30 countries, and we are currently covering 30 million lives. Mediktor is the leading AI-based solution for health plans worldwide, and we have a growing footprint here in the States among hospitals and health systems, such as Albany Med, Columbia Memorial Health, upstate New York, and Blue Stem Health out of Lincoln, Nebraska. We also work with tech vendors such as Teladoc, Core AI, and Telemedic. So you may be wondering why all these companies are working with us. So the main reason is because we address a very big and serious problem in healthcare nowadays, which is directing patients to the right level of care. Hospitals and health systems spend millions of money every year trying to educate patients, telling them what they need to do when they feel symptoms. The truth is that the strategies that have been used so far has not been very successful. And we always use this campaign that was launched a few years ago about from Baker with these big billboards in the highway trying to tell patients the difference between urgent and emergency care. The solution is going to be digital. It's not going to be offline. And the truth is that patients are already checking their symptoms online. Self-triage is a standard practice. They may use Dr. Google, despite the fact that we know that it's very dangerous. The most sophisticated may use ChatGPT. If we put along this fact with the risk aversion of those patients without medical knowledge, means that or leads them to make wrong and unwise decisions. For instance, staying home where they need to seek care, also scheduling an appointment with the wrong specialist, and so on and so forth. And this is the reason why we came up with Mediktor. Mediktor enables hospitals and health systems to direct patients to the appropriate level of care on a safe, convenient, and cost-effective way, anytime, anywhere, 24/7, totally automated. And thanks to unique features such as triage and differential diagnosis. And we have a strong value proposition for you today, for healthcare organizations, which goes around identifying and directing qualified patients, those that are seeking care, to your facilities, to your doorstep, while streamlining the patient journey, reducing wait times and unnecessary steps. And we do have robust metrics that support this value proposition around patient acquisition, 3 times ROI, if you compare the investment in Mediktor and the revenue generated, and staggering 40% user retention, meaning that those that use Mediktor once keep using it in the future instead of going to Dr. Google, ChatGPT, and a strong net promoter score of 72. So how Mediktor works? How are we able to deliver this? So Mediktor basically is a patient-facing solution that empowers patients by offering them on-demand, personalized healthcare guidance at the first onset of symptoms. Everything starts with a free text where the patient is going to be able to input with her own plain words how she feels. This is going to trigger a process of around 14 questions and less than 2 minutes. And finally, Mediktor is going to come up with a list of recommendations suggesting whether this patient needs to seek care in a telemedicine setting versus in person, synchronous versus asynchronous, and the different levels of urgency. So how are we able to offer this powerful user experience? This is thanks to a very sophisticated technology, proprietary technology that we have developed from scratch. And there are a few elements I'd like to point out about our solution. The first one is the depth and breadth of our solution. That includes over 950 conditions, which means that virtually Mediktor can assess all the prevalent conditions you will find in the emergency room in an urban area of a Western country. Secondly is the NLP that allows an easy and human-like conversation. As mentioned, patients can use their own plain words all at once without worrying about misspellings, and it's for all levels of literacy. And what's more important, it's available in 17 languages. We do believe that people should have access to healthcare in their mother tongue, and this is the reason why we keep increasing the number of languages we can use the solution with. Thirdly, as important as languages is the fact that our solution is omni-channel, which means that all your patients are going to be able to access our solution through their preferred channel. I prefer the smartphone, Fred, my colleague, may prefer the laptop, etc. So from the most sophisticated voice recognition solutions to all traditional SMS texting, our solution is available. And on top of that, is available as a white label solution, meaning that patients that are going to be using our solution are always going to see your logo, your look and feel, etc. And last but not least, and this is because one of the co-founders of Mediktor is a doctor himself, Dr. Garcia Esquirol. It's very rooted in our DNA, the need to provide clinical validation, clinical support to our solution. The same way new drugs, new medical devices have to go through a process of clinical validation, we believe that digital health solutions like ours should do the same. So on an ongoing basis, we carry out clinical studies, testing the accuracy of our solution. These clinical studies are carried out by independent third party responsible for designing the protocol, gathering data, consolidating the results. Those clinical studies are done with real patients in hospital settings, and they were interesting enough to get the attention of peer-reviewed magazines that published those studies. We don't have a client that abandoned us after start working with us. We have plenty of referrals that we can share with you for those interested in this type of technology. Actually, you're going to have the chance to speak with some of them and listen to some of them today in the panel. And that basically brings me to the end of my presentation. Now I'm going to leave the floor to Fred Pineiro, who is Mediktor Chief Growth Officer for the States. Thank you so much.
Thank you, Vicenc. And welcome everyone, and thank you for joining us today. I know that all of you have very busy schedules, and we're honored that you've taken an hour of your time to come spend it with us today. I'm also honored to be here with Dr. DoRosario and Dr. Pope, also very graciously taking time from their schedules to be here today with us. And also I want to say one real quickly, also thank you to Steve Love and Chris for organizing and helping us put this on. So why don't we just start with a little bit more background on our panel. If maybe Dr. DoRosario, if you could start, tell us a little bit about yourself, your background, and your organization.
Sure. Thank you, Fred. I'm an internist and had been in private practice for most of my career. In 1996, we formed a very large multi-specialty group, and in 2014, we were acquired and I joined the Yale New Haven Health system as Chief Medical Officer, and I was charged with expanding the outpatient arena due to the paradigm shift that we were experiencing of care shifting from the hospitals. You know, we had a large academic center, 6 hospitals, and now we have 130 outpatient sites along the New York-Boston corridor that include both specialty and primary care. I also served on the Strategy and Innovation Committee at the Yale New Haven Health System, and that was my interest in looking at technology and tools that we could apply in the outpatient world.
Thank you, Dr. DoRosario. Appreciate that. Stephen, I'm going to go to you next. I believe everybody here knows you. I don't know if you wanted to add anything in terms of your background or organization.
No, you know, obviously people know me and I'm not a clinician, but I've been in healthcare 50 years, 34 years, working in the hospital on the business side, on the financial side and the administrative side, and 16 years here at the hospital council. So I've certainly been in healthcare a long time, but I am really impressed with a lot of the new technology that's coming out that's going to help us deliver even better care.
Thank you, Stephen. Appreciate that. And Dr. Pope, this is our mic check for you. Can you hear us okay?
I can. Can you hear me?
Yes, we can. Wonderful.
All right, finally.
So Dr. Pope, a little bit about yourself, your background, your organization, if you would.
Sure. So my name is Ron Pope. I'm a family physician by training. I'm also the Chief Medical Officer for Columbia Memorial Health. We're a 192-bed hospital covering 2 rural communities, Columbia, Greene County in New York. We're also we're an affiliate of the Albany Medical Health System, and which includes Glens Falls Hospital, Saratoga Hospital, and the Albany Medical Center proper. And you know, we've been probably Vincent and I spent about 2 years working on the Mediktor development, mainly because we had a grant, and the grant was with the COVID kept getting extended, so we kept getting delayed with getting started, but we'll talk more about that as we go. This project is something we've been working on for a few years, and it's very exciting. And that's pretty much, I guess, a summary of our group.
Thank you, Dr. Pope. Appreciate that. I think I'm going to throw the first question to you, Stephen, if you don't mind. Tell us a little bit about what were some of the driving factors in your decision to partner with Mediktor.
Yeah, I think a couple of things. First and foremost, the Hospital Council, as you know, has 90 member hospitals. We work closely with associate members, and the hospitals make their own decisions. We certainly don't get involved in the hospital operations. However, when we see products that we think are going to be advantageous to our hospitals, we like to work with those associate members to do things like we're doing today, do a webinar to introduce the product so the hospitals can know that at least it's been through one vetting that we've done and that we feel good about it, and we want to at least offer it up to them for them to do their own evaluation and make a decision. The second thing is, one of the things that we're trying to do here at the Hospital Council is look at ways to drive health equity throughout the region. And I think this device, even though we're saying get treatment at the right place and the right setting, that is really part of health equity, to help people receive the treatment they need and do it in a cost-effective way. So I would say overall, those were some of the driving things that really intrigued us and why we're very glad that we can work with you, especially on this presentation today.
Well, thank you, Stephen. I appreciate that. I'm glad you brought up health equity. I think it's an important topic, and certainly something that we can talk to as we progress the discussions with other organizations in your scope. I'm going to go to Dr. DoRosario, if I may. There's a lot of discussion. AI is the buzzword of the day with regard to a lot of industries, including healthcare. But there are some very practical applications. And I wanted to get your take on what you thought in terms of AI technology being used to facilitate directing patients to the appropriate care level.
Thank you. As I mentioned, I spent most of my career practicing. I still see patients. The biggest challenge we have at all our sites is access, and timely access. One of the biggest problems, and those of us who practice understand, I'm sure Dr. Pope knows this, we often see patients today, and I'm not sure why they're being seen today, because this problem's been going on for a while. Yet we see patients who need to be seen today who actually wind up going to urgent cares, emergency rooms. This is not really what we want to see for several reasons. I think if they see their primary care physician as a point of entry, the primary care physician has all their medical records, has the imaging studies, their lab tests. When they go outside the system, because they have no access to our system, they actually have duplication of care and sometimes inappropriate care because they don't have the medical records. I think one of the biggest challenges we have is that our front desk personnel, like any office, is not clinically trained. So they don't have the ability or the skill set to appropriately triage, see what is urgent, what is emergent, or refer something to a nurse to further evaluate. So they kind of clog up the schedule because it's the easiest thing to do. And then we are not able to see the patients that need to be seen. Delay in care often results in adverse outcomes. Delay in or care outside the system is not cost effective, and it certainly does not enhance patient experience. So I thought that when we looked at Mediktor, one of the biggest advantages was it was very user-friendly. We sort of piloted it with some of our patients. And one of the advantages is that, unlike some other systems, the group at Mediktor, and I worked with Dr. Garcia Esquirol, they were able to tweak the algorithms to fit the needs of what we needed. We did not need something out of the box. We did not need lots of bells and whistles. We just needed something to interface with Epic. And we had two areas that we were focused on. One, patient facing, and number two, the front desk could use this to triage because of their lack of knowledge and clinical expertise.
Great, thank you, Dr. DoRosario. I appreciate that. Why don't we, I was gonna ask you the same question, Dr. Pope, but in the interest of time, I'm gonna go to the next question for you, if you don't mind. And that is, let's talk a little bit about your implementation at CMH and tell us a little bit about, you know, the use case that you were trying, that for implementing Mediktor, and a little bit about what pain points you were trying to address.
All right, so I'll give you just a little brief background. Vincent came to me through, I think it was a board of trustees member that knew somebody that knew somebody that, and so we had a conversation. I was very intrigued by the concept. I was intrigued by the fact that, you know, right off the bat, we could be one of the first kids on the block with the new toy, which is always nice, you know, for the publicity part for your organization, to show that you're, you know, pursuing state-of-the-art technologies. Vincent and I talked for a while. We had a grant for implementing the initial program, and that was I think the only thing that interfered with our launching the program is the grant kept getting extended, hence we got delayed. When we finally no longer had an extension of the grant and we implemented it, the first thing I'll say is that I've worked with a lot of teams over the years, and I have not experienced one that was finer than Mediktor. Their attention to detail, their willingness to do all the heavy lifting is the reason that this was able to launch, because it was really just a team of one. It was myself sort of in my free time. And you can imagine as chief medical officer, I don't have a lot of free time. And I had a little bit of help from our one marketing person and from one of the individuals that works under me, but it was limited. And so we got this launched and we got it out there, but our initial use case was, you know, more of the novelty. But as we implemented it, we started looking at it and saying, you know, actually, I see a much bigger value for this program. We have 2 urgent care centers. So directing people to an urgent care center, you know, that's nice. But as part of a health system, you know, looking at down the road, if you use your health system, which has more resources to kind of tackle this, we have the ability to not only provide additional access, people that maybe don't even need to go to the doctor, or can at least send them to the right location, to an urgent care instead of an ER, so they're not clogging up the ERs, or get them established with a new primary care provider if they need one, that type of thing. So we have all these links at the end that can direct people to care. But if you add 2 urgent cares and you increase it system-wide to 40 or 50, then you start to develop a real power for the region with the same product, where people can select the closest urgent care to them. It's a great tool if you've got competition. We don't really have much in competition, but from a system standpoint, there's competition out there. So if you're able to direct and list all your urgent care centers, and you are getting new business into your system as opposed to your competitor, there's advantages there. There's advantages. There were a lot of health information sheets that Vincent's team put together for us for seasonal things. So we could have things on our website that would, talk about flu or COVID or whatever the tick-borne disease, whatever the, the seasonal issue was. And it also had a link so patients could jump on and check their symptoms. And as we get further into this, we're about to implement Epic. Albany Med goes live in March and we go live in September. Then we will have Epic throughout the region. And there's tremendous opportunity there to start doing a lot more with this program. We've sort of slow rolled it just because of the resource availability. It's, Vincent's team and myself. But they've done a few things on marketing for us, which really impressed me. Very little effort. We increased our number of hits tenfold in 1 month. I mean, it was pretty dramatic, and that's with very little effort. So I think there's a huge upside potential here, and I think we're just seeing the tip of the iceberg. Eventually, would like to have this right in our medical record to be able to really, really truly integrate with the health records.
Thank you, Dr. Pope. Appreciate that. Great information. Glad that you, with your limited staff, were able to get this thing up and running very quickly, it sounds like, and appreciate that information. Dr. DoRosario, let's go to you again, if you don't mind. You have evaluated other solutions in the space previously. What were some of your findings when you did that?
Yeah, absolutely. I think, we identified very clearly this was a great need for us. And I spent time looking at other systems. I spent actually a whole year looking at a London-based system that was very prominent at that time. One of the problems I had was that they really wanted to boil the ocean. It was not very user-friendly. And then I started working with Mediktor. And as Dr. Pope mentioned, they were extremely collaborative. They were working with us. They actually spent time in a couple of our offices here looking at the workflow in Epic to see how they could enhance the workflow rather than recreate the workflow. We certainly were not interested in any disruption. And I think that one of the problems we have is navigating healthcare today for our patients is extremely difficult, and it's getting worse because of limited resources and staffing that we have all been through since COVID. I think the major problem was that I said to them is it has to be user-friendly, it has to be quick, and it has to be able to get people for the right care, the right place at the right time. They're also very much involved in the transition to value-based care. We need an essential tool to be able to have in-network care, especially because we are a very large system. I have to unfortunately say that having spent a lot of time doing this, working with the team at Mediktor, we actually invested in the program. We were about to launch it just before COVID, and had the sign off from the system. But then because of COVID, both here and in Barcelona, we put it on pause. We tried to restart it again 6 months later, and we had a second surge of COVID. We are still currently on pause because, as most healthcare systems, are going through major financial crisis post-COVID. But I think that this is the system that would be right for us to serve our patients and to serve our clinicians.
This is Steve. You had mentioned earlier Epic and the Epic system. Will this tie into that pretty easily, or is that something I should ask Fred about?
Yes.
I think.
Go ahead.
Go ahead.
I was just going to say, Dr. DoRosario, that yeah, we absolutely can integrate with Epic. We have a couple different ways with the App Orchard mechanism that they have, or also Open Epic is another way that we integrate with Epic. So absolutely, integration with Epic is something that we've done, and we think it's an important aspect because the more information that we can gather on a patient before they start bring out the form, the more accurate we can be, the more we can know about them, and also deliver that information back to the system so that they can use the information when they see the patient.
Thanks, appreciate that.
Yeah, I think we did speak with Epic as well because they were trying to develop their own program. We did look at it. I don't think they've had any resources placed in, have not given that a priority. I think our ultimate goal was that there would be a warm handoff from the app, from the patient interaction, so that we would skip a step. And if this was any urgent visit, it would link. That was our next step that we would hope to see. They would link directly to our office, and then the patient would get a call.
Right. Okay. Switching gears here a little bit, I'm going to go to Dr. Pope. You were recently interviewed by Healthcare IT News, Dr. Pope, I believe, regarding your Mediktor implementation, and if you could maybe share with us some of the results you shared with them, and tell us a little bit about that interview and what you shared with them.
So they were interested in sort of the concepts behind the use of the IT. We shared with them, basically what Mediktor has done with, with AI, and we talked quite a bit about the concept of where I think this can develop. Right now, we're affiliate, so part of a health system, but this product is currently being used just at Columbia Memorial Health, and we're in discussions with the marketing team at the system level to see if they have an interest. But my goal would be to see if we could get this on a grander scale, because I think it's a great tool from a business standpoint, as far as directing patients, for access to care, but also access when you have a competitive market towards, your facilities. It's a great tool for patients to figure out which access is most appropriate for them. Whereas patients, a lot of times, they'll show up in the emergency room with a splinter that could have been managed, at the doctor's office, or they'll show up with a laceration at the doctor's office, and maybe the doctor's office doesn't do suturing, and they end up sending them to an urgent care or to the ER. So there is, with limited access as it is in healthcare these days, having the ability to cut out sort of those misinformation steps and get people to the right location, I think is really critical. And then the competitive advantage of being able to direct market share were probably the two biggest things that we talked about. The data that Mediktor is able to provide is extremely helpful. It shows us exactly, what we're getting for hits, whether people are falling through to the end on the app, or whether they're just starting it and getting frustrated and leaving. And we've seen tremendous throughput on this. I'm pretty impressed at how many people follow through to the end. So it's those types of things we talked about, and as a result, they published a nice article which I think summed it up pretty well.
So are you getting new patients that you hadn't seen before from them utilizing the solution?
We believe so, but what we have not done, because we haven't connected it to our EMR, our current use of the product is we're getting the data, but we're not getting the patient information. So it's hard to map it. I say that we are because we've had patients mention it when they've come in for visits, which I think is nice. We've had patients that have gone directly to, when they click on the need a PCP, takes them to our website, and then they get a call from us, and we've seen an increase in volume on that end. but very difficult without integrating, which we were sort of stuck because of the Epic implementation to hold off on that piece until Epic is on board. It didn't make sense to integrate with one system and then switch, 6 months or a year later. So I can't give you as good information. It's more anecdotal. But based on what I'm seeing, I have to believe it will be significant.
All right, thank you, appreciate that. I think I have to be a little judicious on which questions I ask here because I think we're running a little bit on time. But Dr. DoRosario, if I can ask you, what strategies and digital technologies can primary care and specialty practices adopt to improve access and inform and educate patients?
Yeah, certainly. I think we all understand that there is a paucity of primary care physicians, and we are going to have a lot of our care given by APCs who do a great job, by the way. But I think technology is what's going to drive healthcare in what we do going forward. I mean, there's very few things that we do not do on our phone today, and patients expect this. So I think that technology-driven protocols allow for standardized care. I think Epic already has, we have developed with Epic pathways so it can prompt, what tier drug we want to use, what's the next test we need to do to be cost efficient. I think we get prescribing recommendations. We get alerted on drug-drug interactions or potential problems. We get alerted on what gaps of care are present so they can comply with whatever is necessary for their age group and their chronic diseases. We've been using virtual scribes to decrease the burnout that we see with what's happening today. We're using e-check-in. All of those things are really enhancing what we do. I think we need to be cognizant of one fact. Whatever we develop, whatever we design has to be user-friendly. We also need to know that who is our patient population. A lot of them are over 65, but they're all getting very tech savvy. When COVID, we launched telehealth. We had telehealth, but didn't use that a lot because it was not covered. But we had to change our platform 3 times simply because it was not user-friendly at the beginning for that volume and patient, particularly with our older patients who needed the most attention. So I think one of the things to be sure that whatever technology we use has to be not what is suitable for us, but is really user-friendly, and we have to look at the patient population and the socioeconomic status of this patient population.
Thank you, Dr. DoRosario. Steve, if I may, I go back to you for a moment. You've mentioned earlier a ton of experience in your area. You've been know the health systems within the area. You've been there, for a long time. Know the area very well. What do you see some of the, knowing the area as well as you do, knowing the health systems? What do you see as some of the potential benefits for organizations in the area to work with this solution and engage with Mediktor?
Yeah, it's a great question. And, I've worked in different parts of the country, and I've just got to tell you, and I really mean this, here in North Texas, we deliver some of the best healthcare in the nation. We're very blessed with not only the hospitals, the physicians, even the post-acute care that we have, but we have some real issues too. For example, Texas has not expanded Medicaid. 20% of the people roughly have no health insurance. So many of those people, when they need primary care, they come to the emergency room. And that's just not the right place nor the right setting for primary care. And so I am excited about this product because, as pointed out by the doctors, and they were so correct, having coverage is one thing, but appropriate access to the right care in the right place. This may not solve all the problems, but this will be a tool to better match getting access to care and not necessarily just going to the emergency room. And I can also see the benefits of this in mental health. Unfortunately, we have many mental health issues. I know we do across the nation, but in Texas, we rank about 48 out of 50 states related to mental health. I can see this tool at least being effective in helping, in plain language, some of the symptoms they're having to direct them and intervene and get appropriate care. And I think this would be beneficial in an urban setting. I think it would be beneficial in a rural setting. And I think it's very important that we strive to do everything we can, as I mentioned earlier, to look at health equity, look at access and appropriate care in the right setting. This isn't going to solve all those issues, but it's another tool that'll help us get there.
Thank you, Steve. Appreciate that. That's great information. But since before I ask another question, do we have any questions yet from the audience? You're on mute, actually.
Yes, we have a few. I have one that I think is addressed to both Dr. DoRosario and Dr. Pope. It's kind of an open question, but basically it says, what advice would you offer other healthcare organizations considering using a similar technology? So Dr. DoRosario, if you want to kick off.
Sure. I think today, again, the pressing need we have is patients need access. And as we've said over and over again, right care at the right place at the right time. And so we don't have any tools to do that. And just getting through the office on the phone can take forever. So they usually give up and they wind up going to an urgent care where care is not always standardized. Again, we are a system that has many hospitals. And so they often can go to a competitor and then get shipped to a hospital that's not within our network. So I think if you want to keep network integrity and you want to enhance patient experience and you want to provide timely care, you need a tool that is simple to use. You need a tool that will direct them. And we won't get this right for everybody. But right now, we have nothing.
Perfect. What about you, Dr. Pope?
Yeah, I agree with all the sentiment from Dr. DoRosario. I will say that I do think that the urgent care market is sort of taken off. It's a profit center for a lot of places. It's also an entry point for a lot of places. So if you don't get people into primary care initially and they get into an urgent care, where do they go for their subsequent specialty visits, et cetera? And it's the quickest way to lose a patient. We always say if a patient goes out of the system for one provider, who then sends them to the cardiologist, to the pulmonologist, all within their own system, you've lost the entire patient. So from a competitive advantage, this product really, I think, has a lot of potential. But I also think that for people that want to get involved, I know you guys have done some work with nurse triage. So a lot of places have tried to reduce the physician burden on call, and they've been able to utilize this product as a nurse triage tool so that the nurses could direct them to the right level of care. And that's also an option. I think there's a lot of creative ways to utilize the product. I think you have to look at what your particular needs are and where you'll get the biggest bang for your buck to start. But I foresee this product being able to be used in 10 or 12 different directions if you fully integrate it and use it, for your to all of the potential advantages it has. It's just a matter of you need somebody to be committed to seeing the project through as I sort of illustrated. You know, it's mainly just me, but if I had just sort of fizzled on that, this project would have fallen apart. And so if you've got an organization that's interested in pursuing this, you need somebody that's going to own it and is going to keep pushing it through to the next layer and the next layer. And I think you'll reap some huge benefits.
So Vicenc, I just want to make one comment. I think what attracted me to Mediktor was the fact that this was their core business. There's a lot of vendors out there who sell everything from analytics to HCC coding modules and so on. And I think, as you know, I'm a foodie and I will never enter a restaurant that has 16 different cuisines because the chef cannot be really good at any one thing.
That's
and
right.
I've always told our system folks is there are some things we can do in-house, there are some things Epic can do, but there are some things that should be from a dedicated vendor that integrates with Epic.
Okay, perfect. So bear with me, Dr. DoRosario, because the next question I believe is for you. An attendee says, when I asked Dr. Google about the competitors of Mediktor, Google came up with a long list. What is your primary point of difference? So what do you think Mediktor's primary point of difference compared to competitors? I'm asking because I know that you did kind of a due diligence comparing with Epic Symptom Checker, Babylon, etc. So if you had to point out like that feature, that element that allow us to stand out compared to competitors, which one that be?
My experience demonstrated that the Mediktor team was very dedicated to stay within the guardrails. This is what they wanted to perfect. They were not trying to start with this and go into 15 different directions. But I think what was most impressive for me was that they took the time to understand the workflow, having come to our offices, spent a couple of days with not just the doctors, but with the staff to identify the pain points. They spoke with patients to identify the pain points. And then they said, what's really essential in any product today when we try to implement it is to have a sense of collaboration, that they're going to work with you for your needs and not change what you're already doing or what you already have.
Exactly. So I like to, on behalf of Mediktor, I'd like to add some more color on this question, because beyond the team, as Dr. DoRosario was mentioning, I think that's something that where Mediktor really excels compared to the companies in the space is we are in that sweet spot when it comes to the user experience and the accuracy, the clinical validation that you request to this type of companies. So it's true that there are a lot of companies that are mushrooming, especially after COVID-19, but those that are in that sweet spot, and we measure the user experience basically in the number of questions asked and the time spent, right? And the same level of accuracy, I think that there is another company that beat us. And this is thanks to the NLP that we have deployed that I was referring before in the presentation. Our NLP can virtually understand anything that has to do with signs, symptoms, and conditions that is typed in a free text. And this allows for a smooth assessment, which means less patients dropping off the assessment and eventually reaching the conclusion, the recommendation of Mediktor and directing those patients to the next level of care, right? You may find other companies that they may ask a lot of questions and therefore losing a lot of patients meanwhile. So there is another question that I believe that this one is more addressed to Dr. Pope. You mentioned grants, and this got the attention from the audience. So are you familiar with any grant available for this type of projects anymore? I assume that it's at a federal level. We have some insight on it.
Yeah, what I'll tell you is we had a general, I think it was a state grant that was directed towards telehealth. And this fit into the mold of telehealth. And so we had this grant. We really didn't know what to do with it. Mediktor came around and it seemed to fit nicely and covered our implementation costs. So I think you just have to do some research, and I would look in the telehealth space or the technology space of healthcare and see what's available. I have to believe there's still a lot of grant money out there in this department. It's still a pretty hot topic. Just a matter of finding it. If you have somebody who's a grant writer, they're pretty good at locating these grants.
Okay, thank you. So there are a few more questions, Fred, but we are almost on top of the hour. So what we can do is through the Dallas-Fort Worth Hospital Council, make sure that we answer all of them via email. But back to you, Fred.
Yeah, so we'll make sure we absolutely answer all your questions. We want to make sure that we answer all those questions. We also want to make sure we offer an opportunity to, if you guys want to see a demo, if you want us to have a more specific conversation. I think Steve and the team are going to provide contact information, or they can contact you and reach out to us. But we want to make sure that you have our contact information, so that if you do want to do a follow-up, we're happy to do that.
Yeah, just so you know, Chris Wilson, who does a great job on these webinars, is recording this, and for the people that have registered, they're going to get a copy of the recording tomorrow. You know, to the extent you look at the questions that have not been answered, but you provide us answers, we can certainly share that also with the people that registered. And then finally, when Chris sends that out, he will put contact information also, so that everybody gets it from one source from Chris. And at that point, people that are interested obviously will contact you. Is that okay, Fred?
Perfect. Appreciate that. That will work perfectly. And so we'll answer those questions, and we'll get those to Chris for him to include in information back along with the link. I know we're right up on the hour here. I just want to say one more time, thank you, everyone. We really appreciate your time today. We know it's difficult to get away for an hour, but we really appreciate your time, and look forward to having good discussions. Thank you to our panelists again.
Thank you.
Thank you, everyone.
Take care.
Thank you.
Bye-bye.
Thank you.
Bye.